As you're aware, many employee groups around the country, and public and private employers, union and non-union, have sacrificed wage and salary increases in recent years in order to maintain affordable health benefits. At least one of the bills, the so-called Baucus bill out of the Senate Finance Committee, calls for a 35% excise tax on health plans that employers provide to their employees over a flat dollar amount. That's a flat dollar amount that doesn't vary by region of the country, that doesn't vary by the demographics of the workforce, which can greatly impact how much it costs to insure a population. How do you feel about that excise tax? Do you think that's a good approach to fund some of the subsidies that are going to be available to help people who don't have insurance right now, even if it means cutting back health benefits that employees may have sacrificed wage increases to keep?
Well, I want to get to your question, but I think I would construct it just a little differently. Everybody has suffered because healthcare costs are out of control. Real wages have been flat in this country. Take-home pay has been flat for years in this country because healthcare benefits are going through the roof. So even if people are apparently getting raises, those raises are going to pay off health care. And so person's take-home pay hasn't changed. It's been flat. We've all experienced that, not just people who are employed in certain sectors. But then to answer your question about the tax and how do we pay for this, I want to go back to what I said earlier. I'm of the opinion we don't need more money in health care. We need the money that's in health care to be better spent. And when we spend it better, when we save in health care, we'll be far better off. And I'll give you a couple examples of things that would actually save money. There's a clinic in Pennsylvania called the Geisinger Clinic. It's an excellent clinic. It has the reputation of Pennsylvania as the Mayo Clinic does here in the upper Midwest. The Geisinger Clinic has a guarantee. If you have heart surgery at the Geisinger Clinic, and you go through your surgery, you are discharged, and then you are readmitted to the hospital for any reason in the next 90 days related to that, they will not charge you. That's the Geisinger guarantee. They are so confident of the results that you will get if you have your heart surgery at Geisinger that they are going to guarantee those results. Well, imagine how much money that would save if it wasn't just heart disease, but it was knee surgery or hip surgery or treatment for other things. And if healthcare systems were so confident of their results that they actually could guarantee that if you came back, they wouldn't charge you. That's the future. That's where we need to be going. And Geisinger and other clinics are showing the way. Very interesting.
Moving to the state level for a moment, you served on the Governor's Healthcare Transformation Task Force. He recently came out and made a very strong statement in support of allowing out-of-state for-profit insurance companies to come into the state to sell their products in Minnesota. Was that part of the task force's recommendations at the time that you participated on that group?
No, it wasn't, and it wouldn't help. At least it wouldn't help enough to even bother with doing it. The price of insurance, like the price of anything, is really based on three things. The cost of the product itself. So what does it cost to deliver health care? Plus the administrative cost of a health insurance company, plus their profit. And that adds up to what is the price of the insurance. So we in Minnesota here, I think, are very fortunate that our insurers are not for profit, which is not to say that they aren't interested in making sure that they have a black bottom line instead of a red bottom line. But to bring in a bunch more companies into Minnesota does not help us solve this problem at all. In fact, it would create more confusion. So I just flat out don't think that it's a reasonable idea to pursue.
I think there's some question there that if that were the silver bullet that we're going to lower our health care costs in Minnesota, why hasn't it worked out in the rest of the country? We are having a national debate on health care reform because of costs nationwide, after all, and many of these companies that would be coming into the state are already competing in other states and haven't managed to solve the problem there. So.
Well, you're absolutely right, Ted.
All right, well, thank you very much, Dr. Reed, for joining us today, and good luck on the rest of the campaign.
Thank you. Nice to be with you, Ted, and the viewers. Appreciate it. Thank you.